This new program, the Molecular Transducers of Physical Activity Consortium, which we call MoTrPAC, which is kind of a nice way to imply what this is about, because it's about motor activity of human beings, is a rather innovative approach to try to understand what actually is the basis of the benefit from exercise. We know that that's good for you. We don't really know why. We don't know how it works. We don't know what the molecular signals are that result from exercise happening to your body and that resulting in a better outcome. As a first step, the consortium aims to try to develop a map of all those molecular signals that are happening during exercise. We know that different parts of the body talk to each other during exercise, but we don't know what their language is. And we're trying to figure out the voice that's being used by these molecules in the space of an exercise program that actually improves other parts of the body's function, whether that's muscle building or whether that's strength of bones or even mental status and resistance to depression. All of those things we know are in there, but we don't know how they work. The other part of the consortium is not to be a closed shop, but to have this be a new kind of data access plan where anybody who's got a good idea about what is going to be a pretty large data set can start to sort it through and see what we can learn about those molecules, how they work, and what we could do to improve the way in which we advise people about exercise. Well, we already know physical activity is good for you. Lots of evidence there. Much of it, though, is focused on specific body systems, building your heart into a healthier organ, doing something about risks of diabetes, or something about depression. But we don't really look at it in a more holistic way. How is it that exercise provides these benefits? And so we've had to make recommendations that are a bit more empirical than we would like. If we could figure out really what is the molecular basis of the benefit, we'd be in a better position to be able to make recommendations that have the kind of evidence that people would like to see, so that when you get that kind of a prescription for your own exercise program, you'll be confident that it's based upon a real understanding of how this works. Well, there are physical activity guidelines, and we think that's a good thing, and many of us try to adhere to those. But we haven't really been in a position to know whether we've got the optimum kinds of recommendations, the kinds of exercise that would give the greatest benefit. And particularly, we haven't been able to think about individual differences. We talk a lot about personalized medicine, or I do anyway, and the idea that individual recommendations ought to be made specific for that person and not one size fits all. And yet a lot of our exercise recommendations are more one size fits all. If we could understand the molecular basis of how this all works, we would undoubtedly find individual differences. And what works for me in terms of a combination of cardio and weight training might be very different than what works for somebody else. We want to discover that. That's what this program is going to teach us. When you go to the doctor and you get an evaluation and some diagnosis maybe is made, or at least some recommendations about how to stay healthy, that ought to be improved in terms of the part of the recommendation that relates to exercise by understanding it better. Frankly, I think right now doctors, I'm one of them, are a little unclear about exactly what they should recommend to somebody about staying healthy or managing a chronic illness, because we don't have the kinds of biomarkers that would measure whether a particular intervention is working for that person or not. This aims to try to go down that road towards much more specificity, much more evidence, much more abilities to say what's good for you as an individual, as opposed to some more generic recommendation. Well, you might ask, why didn't we do this before? A lot of the reason is the technology to be able to approach this problem just didn't exist before. Now we have the opportunity, though, to really see what proteins, what other kinds of molecules are released from various body parts when you're going through exercise, what kind of signals, what molecular messages are being sent from one part of the body to the other, takes a very sensitive technology to look at those things, whether it's proteins or nucleic acids that are floating around. Our sensitivity, our ability to look at those things much more comprehensively has gotten much better in the last few years, so that we can now contemplate doing something which even a year or 5 years ago would have been pretty hard to imagine. This is just the right time to take that technology forward. And that's one of the reasons to do it. The other reason is the ability now to collect these kinds of very large data sets and make them available to lots of people. This is a big data issue, and NIH is very invested in big data, and particularly collecting those kinds of data sets and making them widely available so that anybody with a good idea out there somewhere on the planet can begin to go through this information and come up with the answers we're all looking for.